Glenn, one of the things that we always tell our patients regarding complications is that I will say, I speak to ovarian cancer specifically, the benefit from surgical debulking and having radical cytoreductive procedures, meaning if the tumor is on the liver, doing the liver surgery, and not just limiting yourself to the pelvis, like going after every speck of tumor, the benefit of that has been shown over and over and over again in our literature. So especially when it comes to ovarian cancer, the difference between even 1 centimeter residual disease or no residual disease is in the order of years. So we're not talking about something minuscule, especially when it comes to our cancer. So like many, many months of difference between a suboptimal debulking, meaning someone who has gross residual disease, or someone who has a complete resection. The difference in survival is dramatic. So the idea is that, can we get the patient through this radical operation or this aggressive operation, but the Hipec is additive to the cytoreduction. So the majority of the complications that you will see, if when we see a complication, it has to do also with the surgical aggressiveness and that is needed for the long. So it's kind of short-term pain for long-term gain. You need to perform these procedures that have an inherent higher complication rate. Like clearly, your chance of having a bowel leak is higher when you resect the bowel versus not resecting the bowel. But if resecting the bowel means you get to no residual disease and added years of life, then that risk, everything in medicine is risk and benefit. So there is absolutely an inherently increased risk of complications with radical cytoreductive surgery. But the idea is, and this is what our data shows as well, is that the 12-week mark that Dr. Möller was talking about, or the 8-week mark for the most part for ovary cancer, are there significant delays in commencing chemotherapy? Is the patient back to baseline? And while the route to those 8 weeks or to that 12-week point might be a little rougher after you do this, at that mark, most patients, we find them anecdotally and in the literature, are doing pretty much the same. And the benefit in terms of survival, you've kind of invested in that sense. So there's definitely complications, but if you can get them to where they need to get from a debulking point of view and a Hipec point of view, then that's worth it.